My name is Noura Aidid. I have a role of managing this program and a role of chairing the meeting event today. We will be starting at 9 a.m. UK time, and the program will end 11 a.m. UK time. We are planning to record the meeting, if that is okay for everyone. And in time, my network will not work today. My colleague Audrey will help and chair the meeting. I'm now officially handing over to Ben to open the meeting officially for us. Over to you, Ben.
Noura, thank you so much. And a very warm welcome to everyone to the launch of the Nursing Now Challenge Fellowship Programme. My name's Ben Sims and I'm Chief Exec of the Tropical Health and Education Trust, THET. And we're absolutely delighted to have you here and delighted to be here ourselves. For those of you who don't know, THET is a 30-year-old charity based in the UK but working internationally and with colleagues across 10 countries. Our passion is for health workers and for the role they play in strengthening health systems. An especially warm welcome today to the 61 early career nurses and midwives who have successfully applied to become fellows. You should know that we are full of admiration for what you have achieved and full of excitement for the projects that you will be doing with us in the field of quality improvement. You are drawn from 8 countries across Africa and Asia, and although the context in which you work varies enormously, as early career nurses and midwives, you also face some common challenges. And first and foremost is the lack of recognition for nursing and midwifery that we observe globally. These were the insights we learned from the Nursing Now campaign, which preceded this programme. And I'm delighted to think that this programme will, in a small way, help redress the balance by improving the status of nursing in your respective countries. Truly, each of you is an ambassador for your profession. And I can't wait to hear the insights from you later, from Nepal, from Ethiopia, from Somaliland. I'm also delighted that we are joined by 2 people who are absolutely crucial to this programme. Professor Lisa Bayliss-Pratt, the director of the Nursing Now Challenge, and Shirley Baines, who is the chief exec of the Burdett Trust for Nursing and who's made all this possible. I'd also like to very warmly welcome our partners from the University of Global Health Equity and the Ubura Institute, who will be sharing their expertise in leadership training. This launch event will be recorded, and those of us on Twitter are already helping to spread the word enthusiastically. I'd also, if I may, like to encourage everyone to join the community of practice on Pulse. And I'm going to ask a colleague to put the link in the chat box. But Pulse is an online platform that now has over 700 members from across the world. And in a time of reduced travel, when the need to compare notes across borders, to learn and collaborate with each other is greater than it ever has been, Pulse is the ideal platform. It's a safe place where we can be amongst friends. And today we are indeed amongst friends. It gives me great pleasure to welcome my colleague Noura Aidid Ibrahim, who is Director of THET Somaliland and the Programme Manager for this work. She is herself a nurse and a leader of whom we are very proud. It is Noura who will be chairing today's event, so without any further words, I pass over with great admiration to you, Noura. Thank you.
Thank you, Ben. That is really appreciated. As Ben said, I'm a nurse midwife by background, and I have a role of leading this program. So I'm going to give you an overview of this program, and I think the Nursing Now Challenge Fellowship Program and other Nursing Now Challenge will be talked about by Lisa today. So the Nursing Now Challenge Fellowship Program aims to build the leadership of early career nurses and midwives in Africa and Asia in alignment with the Nursing Now Challenge. There are other programs funded by the Nursing Now Challenge, which this program is part of those programs. And we will hear today from Lisa more on Nursing Now Challenge, Fellowship and other programs that are supported by Bearded Trust of Nursing. So this program is funded by Bearded Trust of Nursing and managed by Tropical Health Education Trust with collaboration with other health training institutions in the UK and LMIC. So this program is engaging nurses and midwives working through the health partnership. So when I'm saying health partnership, that means a partnership in the UK and similar partnership in LMIC countries. So the fellowship combines a structured leadership training with the delivery of quality improvement project led by nurses and midwives. So we are hoping that the leadership, the fellows will undergo a structured leadership training and quality improvement training. Then they will identify a quality improvement project, which this program will support the implementation of those projects. Next slide, please. The overall aim of the program is to increase the leadership of participating nurses and midwives from LMIC countries who will get an opportunity to enhance their leadership knowledge and skills. The program will raise the status of nursing and midwifery. So through this program and this opportunity and the continuation of their leadership skills, they will be able to support the health system of their countries. And we will hear challenges they face presenters from Nepal, Ethiopia, and Somaliland today. This program also aiming to raise the status of women within the health workforce. We all know in any country that nurses and midwives are more than 50% of the total of health workforce, which majority of them are women. We are also aiming to improve quality of global health projects undertaken by health partnerships. Next slide, please. This program is supporting 10 health partnerships from 8 countries. We have 61 fellows in this program, and the program is 1 year, starting in January 2022. That's why we are launching the program today. So the leadership training delivered by a University of Global Health Equity, and I hope they will present today their training program, and a technical training on quality improvement, which delivered by a Obora Institute, and I hope they will also present their training program today. And then development of quality improvement projects developed by the fellows of this program, and then supported by the technical partner and the health partnership institutions. As Ben has said just before a few minutes ago, we have a Pulse platform that they can able to get a lot of learning resources, and they can also communicate with other nurses and midwives in the globe, and they can able to get more resources in the Pulse platform. So that I hope they will join the Pulse platform and they will get that opportunity. Next slide, please. The 8 health partnerships, as you can see, we have 10 UK partners. You can see the list. We have also 10 LMIC partners and 8 countries and 61 fellows. So the 61 fellows, we have 25 midwives and 36 nurses. So thank you very much. I think that is the overview of this program. I'm now handing over to Shirley who is the Chief Executive of Better Trust of Nursing, to say her word. Please welcome Shirley.
Hello, thank you. I'm delighted to be here on behalf of the Burdett Trust for Nursing, and congratulations to the new 61 fellows. This is a fabulous programme, and it has the potential to make positive changes to patient care and will develop nurse leaders with new capabilities propelled by the learning framework which has been put in place. That's all I want to say. It's going to be a jam-packed morning, so I pass back to Nura.
Thank you very much, Shirley. I'm now handing over to Lisa to say and present Nursing Now Challenge globally. Thank you very much. Welcome.
Welcome, and thank you so very much, Nura, Ben, Shirley, and colleagues. It's I can honestly say that I've got goosebumps listening to what you've achieved already in the design of this programme. What's so amazing about the Nursing Now Challenge is that it doesn't work in isolation. Everything that it does is in partnership with other people. And the fact that you've been able to galvanise 61 early career nurses from the places that you have with the partnerships on board is a true testament to the excellent work that THET undertakes day in, day out with health workers all over the world. So a little bit about the Nursing Now Challenge, which we're incredibly fortunate to be sponsored by the Burdett Trust for Nursing. And it sits within Coventry University with 3 amazing colleagues, well, maybe 2, not 3, because I'm one of them, but the other 2 are Hannah Finch, who is our Director of External Communications and Relationships, and Andrea, who is our Project Officer. The Nursing Now Challenge has really worked hard to make sure that not only we build on the successes of the 3-year global social movement Nursing Now, but also that we've got robust governance in place. And I guess there's 2 key ways that we've been able to achieve this. One of the key lessons from the 3-year global movement was the importance of getting and engaging influential leaders, some of which need not be nurses and midwives, because actually we know ourselves as a nurse that I am, the work that we do and the difference that we make, but we need to tell other people that, and we need to shout loudly. And as a result, we've got a fantastic influential advisory board that you can see on the slide set that's got people that have run services in Africa, for example, Francis Omazwa, to Maureen Bisanyago, that's an absolute expert in quality improvement, and many more. So we've got really great strategic influential members that give us wise counsel, that are very interested in this programme, and that help us to amplify the work of early career nurses and midwives all over the world. In addition to that, and as importantly, in a non-hierarchical way, we've also set up early career nursing now challenges, which are made up of early career nurses and midwives themselves from all over the world. And they give us that fantastic grassroots insight into the day-to-day challenges and opportunities that nurses and midwives face in their early careers. And they too are very excited about this programme and look forward to learning and hearing more about how you're achieving this excellent partnership work and raising the profile of all that you do. Next slide, please. And just as a reminder, the Nursing Now Challenge, I feel like it's been almost within my DNA forever now, but in reality, the Nursing Now Challenge was only just relaunched on June last year. It followed on from a hugely successful programme called the Nightingale Challenge that was very much part of that 3-year global social movement with Nursing Now, which was headed up by Lord Crisp in partnership with the WHO and the International Council for Nursing. And it's great that I can share with you that we still stay connected to those people and those influential organisations. And I'd like to think that we complement all that they do with our work. And our challenge is to get 100,000 early career nurses and midwives, and indeed students engaged in this network to really amplify and provide inspiration, support and opportunities right at the beginning of careers in health. Next slide, please. So I've talked a lot throughout because it just comes very naturally to me to talk about what the Nursing Now Challenges is all about. But fundamentally, it is really about raising that profile, power and potential of early career and student nurses and midwives. It's so important for us that we don't talk to ourselves, but we engage our healthcare employer colleagues, universities and colleges, so that they really think deeply about how do they build that leadership capacity and capability right at the beginning of either employing a nurse or midwife, and indeed training them within undergraduate programs. So we're very successful to date in creating a really vibrant global network that we want to go from strength to strength. And as a result, as I mentioned earlier, we've established partnerships in lots of different areas. And this has brought many things. It's brought new insights into healthcare workers, from vaccines to nutrition, right through to thinking about how you support people that have had a neuro injury. And it's also enabled us to create a number of challenges that have resulted in prizes, some of which include speaking at conferences to actually having sums of money. So we're very grateful for our partners, and we're always looking to recruit new ones. So if there's anybody out there that would like to partner with us on some of our initiatives, then please do drop me a note in the chat box. Next slide, please. And this is just, you know, we can probably flip this quite quickly, but it's just sometimes interesting to look at what we've been talking about and what are the common themes. And I don't know how many of you are familiar with this Wordle tool, which actually picks up sort of things from Twitter, picks up things from our communications. And what's really clear is that we are absolutely global. We're about connectivity, advocacy. It's about hearing the voices, linking with midwives and students, and very much, you know, how do we recruit and attract and retrain nurses and midwives all over the world. So delighted that we're not an echo chamber, but we actually reach out, look out. And as you can see from this Wordle, our voice and our messages do reach many audiences that touch many countries. Thank you. And this is just some of the latest figures, which I'm always very, very proud to share. So as I said, we relaunched in June last year, and you know, we've got over 45,000 early career nurses and midwives engaged from 879 organisations across 84 countries. And we split that amongst the WHO regions. And as you can see, Southeast Asia is at the moment the most popular, but we're working through our Challenges Committee and that influential board that I mentioned in order to see how we can engage as many countries as possible across these WHO regions. Next slide, please. And this is just to share some of the resources that we have invested in. So most recently, many times when we talk with our early career nurses and midwives, they want mentorship and they want support. So we've been able to invest in a mentorship app, I'll just get my words right, called Vigo, which provides electronic opportunities for people to virtually connect and mentor and support each other and share materials. We've also been very delighted to partner with a European company called Lecturio that, out of the goodness of their hearts, has provided free access to nurse leadership materials that is available for you to actually go and engage with at any time you wish. We also are really delighted that we've been able to keep our chief nurse from the World Health Organization engaged, Elizabeth Iro, and we have conversations with her about how we use that fantastic document, Agents of Change, which was born out of Nursing Now, ICN and the WHO through that 3-year movement to really continue the momentum on raising the profile, status and investment of early career nurses and midwives. And that very much is fed into the WHO document on the global strategic directions. And a lot of what we do makes a reference back and forth to these documents because we want to be evidence-based and we want to build on what's already out there. So very much rooted in these sort of initiatives, evidence and emerging policy in order to shape the work that we do moving forward. Thank you. Next slide. And this just gives you an idea, and please do have a look at our webinars. They're advertised through various social media mechanisms. But as you can see, just reiterating that the voice that Nursing Now carries across different countries and different places, you can see that, you know, when we talked in November about nurses and midwives in crisis, 204 participants from 34 countries. And when we talked about brilliantly the role of nurses in research and rehabilitation, we had nearly 1,000 participants. Now, I think that's seismic in terms of change, because certainly 20 years ago when I started my nursing career, I liked the idea of research, but actually knowing how and what to engage in research and be able to really have sophisticated conversations about it, where I can honestly say not at the forefront of my mind because I hadn't been trained in that way. So the fact that research is so prominent now and attracted so many people, I think is testament to how our wonderful profession of nursing and midwifery is moving to be more and more evidence-based as it continues to mature across the world. Next slide, please. And this just talks about some of our global solutions that I mentioned. So this was an opportunity and continues to be opportunities for us to throw out a challenge and invite early career nurses and midwives from all over the world to come up with solutions from our partners. And, you know, you can see some of these examples throughout what we do. But in essence, this is about attracting partners. This is about giving people the opportunity to come up with a new idea and get their voice heard. And the winner then to have the opportunity to raise their profile yet again. And we've had some fantastic events with many influential partners that have seen early career nurses speak with eminent people that have been around for many years, be able to sit on international panels with the World Innovation Summit for Health, for example. And this is work and a work stream that we continue in earnest because we think it's a real opportunity for early career nurses to get to be amongst people that they wouldn't normally find in their day-to-day work. Next slide, please. And this is again more just to show you some of the partners that we've engaged. So we're really delighted that we've had JM Mental Health, we've had work with the BMJ, work with, as I said, the Sabin Institute, WISH, and many more. So keep an eye out for these because there's lots of rewards to getting involved that really can give you as an early career nurse or midwife the opportunity to put something on your CV and to talk about something that you wouldn't normally get the chance to do so. Next slide, please. And, you know, just to say we're challenging the status quo all the time, and our early career nurses through the Challenges Committee are really, really passionate to do this. And they're very much looking forward to shaping this agenda and being seen as those change agents that really do make the difference. And their challenge really to themselves that we support is very much about promoting the nursing midwifery agenda and really influencing it within their communities. Next slide, please. And this talks about, again, just our footprint to date, where we've got our early career nurses and midwives and where these Challenges Committee currently sit. And all the time we're growing our footprint, and we would like to see little pink dots all over that map, all over the world. And that's certainly our ambition moving forward. Next slide, please. We're also, as you might imagine, very focused on the global mental health and well-being of early career nurses and midwives. And I know THET have done some amazing work in this space as well, but we're really keen to hear and learn from early career nurses and midwives, not just what the problems are, but what are the solutions? What's within their gift as individuals? How, as emerging leaders, can they influence their colleagues, their teams, their managers, to be kind and compassionate to each other? And then what at policy level, whether that be organisational policy linked to pay terms and conditions, or wider policies from ministries of health about how we hardwire mental health and well-being into the work of nurses and midwives. Because I think we all know that if we don't look after ourselves, we haven't got a good chance of looking after others. So we have to put this front and centre. And we're doing a lot of surveying and thinking really deeply about what data to collect and what we can learn. So we don't reinvent the wheel. We don't just say more of the same, but we provide something that we can give to early career nurses and midwives in many ways that they can start to begin to influence this agenda from the very beginning of their career. So watch this space on that. Thank you. And this just talks again about our collaborators, and I just think it's worth showing it because not only am I delighted that Thet, of course, is one of our key collaborators and really joined forces with us and Health Education England to reinvigorate, I guess, and to think about the next phase of the Nightingale Challenge, which has become the Nursing Now Challenge, but also that, you know, we're connected very closely on this agenda and many other things. And we know that we are always stronger when we work together, and working together, sharing and learning is the best way that I believe we can really start to see the changes and to really raise that profile and ensure that nurses and midwives get the recognition, the reward and the opportunities that they so very much deserve. Thank you very much for listening, and happy to take any questions in the chat box or offline. Thank you.
Thank you very much, Lisa. That was fascinating presentation. I hope now everybody understands the Nursing Now Challenge and some of the solutions that has been presented. Thank you very much. I'm now calling Rosani from Nepal Nursing and Social Security to present some challenges that the nurses and midwives face. So thank you very much. Please welcome.
Yes. Thank you, Neil. Good afternoon and good evening to everyone. This is Rusni Laxmitudi from Nepal. It's our pleasure to present on behalf of Nepal. Myself as well as Bala ma'am is here. I want to explain a detail that in Nepal we have a very good opportunity in the policy and the administrative level from the nursing and midwifery aspects, but still there is a challenges. So in our context, the nurses are exposed in the policy level, academia, practical and other sectors too. And we have a lot of opportunities, but within that opportunity there is a challenges too. So the details about the presentations, Bala ma'am will continue that presentation. Just I want to highlight it that we all have the opportunity, within that opportunity we have a challenges. So the details will be presented by Bala ma'am. Would you please just go ahead?
Thank you, Rosli ma'am. I would like to request organizer to allow us to share the PPT, as we have already, there is a PPT presented in the screen. So
you should be able to share your screen now.
Yeah, thank you so much. Can you see my slides?
Yes, we can. Thank you.
Thank you. Namaste. I'm Bala Rai. I'm Student Hospital and Nursing Administrator, and currently I'm working in Nursing and Social Security Division. So thank you for providing this opportunity to share the leadership status of Nepal in context of nurses and midwives. So I would like to share what is the status of nurses in Nepal from the different sectors, especially starting in the policy level, as we have the post for Senior Hospital Nursing Administrator in Medical Service Education and Research section. in Ministry of Health and Population. Similarly, we have nursing officers in QSRD, which is quality section, and similarly policy planning and monitoring division, and also in the gender equity section. So in Ministry of Health and Population, we have nurses, nursing administrators, and nursing officers in MOHP. Similarly, talking about our division, which is Nursing and Social Security Division, which is established on 2075 BS, and the director is Chief Hospital Nursing Administrator, who is leading this division. So similarly, within this section, we have furthermore two sections, which is Nursing Capacity Building section and Geriatric and Gender-Based Violence Management section. In this, both of the section, we have section chief as Hospital Nursing Administrator, and we have nursing officers. And also we have community nursing administrator in JC, Geriatric and Gender-Based Violence Management section, along with the community nursing officers and nursing officers. Similarly, we also have the representative of nursing officer in Social Security section. So basically, I think Nursing and Social Security Division is one of the historical division in Nepal, where nurses are working in the policy and as well as in the implementation of the policy, where we hospital nursing administrator, community nursing administrator, and nursing officers are working for the policy development, policy implementation, and also advocating and all reflecting in the policy activities as well. So similarly, we have the representative of nursing in Family Welfare Division in DOHS, which is section chief leading the family planning and RS section, and she is her post is also community nursing administrator, and we have 4 nursing officers working in Family Welfare Division as well. So similarly, in not only in the federal government, we also have the nursing representative. I would like to take up my marks so that my voice is more audible. And we have nursing officers in Ministry of Health also, in the provincial Ministry of Health, like in Gandhari Pradesh. So we have the representative over there, and similarly in the Provincial Health Directorate and also Social Development Ministry, and also in the local levels like municipalities. So this is the representation of nurses in Nepal. So in the centers also, we have nursing officers like in National Health Education Information and Communication Center, National Tuberculosis Center, and National Center for HIV/AIDS and Sexually Transmitted Disease Center, similarly National Health Training Center. So these 2 slides is just a glimpse of the presence and the role of the nurses working in the policy level. In the now talking about what is the background. So similarly, I think we also, the nurses and midwives working in Nepal also have been facing similar kind of issues where like around the globe. We are struggling to be coming in the policy level and acting as a, just growing as a leader. So similarly, we have, though we have nurses, but the number is very few. So few of nurses are in the policy levels. Still, we are struggling to, come and act as a leader in the policy level. So, and similarly, poor staffing is a global problem. So similarly, we do have the problem in Nepal, and the enabling working environment has been always a challenge, and also the morale of the nurses has been, decreasing due to the various factors, including the working environment as well, and brain drain. So brain drain also has been one of the challenges for the Nepalese nurses and midwives. So now talking about the scope of nurses, we have, many areas where nurses can work and have been working too. So in government sector, as I already mentioned, so we have Chief Hospital Nursing Administrator, which is the first class officer in Nepal. So we have, so I just want to excuse, there is a slash in between the 5 and 12. Currently, we have 5 Chief Hospital Nursing Administrator, and the post is 12. So among the 12, we have 5 Chief Hospital Nursing Administrator. So Hospital Nursing Administrator, we have 21 in the 29, out of 29 posts, we have 21 is fulfilled. So these are the young nurses are, has been recruited a few days back. So total we are 21. So community nursing administrator, there are 2, nursing officer 125, community nursing officers 13, public health nurse 78, and staff nurses 1682. So similarly, these are the reflection of the government sector, and definitely in the coming days, as the roadmap from the HRA strategy and roadmap, definitely the number of nurses will increase. So talking about the private hospitals, they also have the leadership post like matron, which is a director of the hospital, a nursing director, and then we have a nursing supervisor and nursing in charge. So in the private hospitals also, nurses are working in this kind of post as a leader, and they have been working as a leader and a manager in the private hospitals. So now in the academic area also, we nurses have, a kind of extended scope, and we have been working, since the starting of this profession as in the government nursing college. Nurses are working there as a campus chief, as a program coordinator, and similar registrar is also appointed from the nursing college as well. So in the TUIM, we have dean, assistant dean, has been also been from the nursing fraternity, and also in the private nursing college also there is campus chief and program coordinator. So in the academic sector also, nurses in Nepal have been working as a leader and as a manager since the beginning of our profession. So now talking about the other areas, so we have started, as we all know, we have started school health program in Nepal, and now currently from province 1 to province 7, we have school health nurses. So there are total 841 school health nurses currently working in Nepal in all of the provinces. Similarly, we have started community health program, which is a public health program from our division. So the scope has been widened here, and then many of the nurses are working in the research sector and also in the development sectors like NGOs and INGOs, and they are working in the leadership post. So now talking about international exposure, we nurses from Nepal and midwives from Nepal also has been involved in the GNLI leadership program, and currently I think maybe more than 12 nursing leaders have been involved in this program, and currently our chief nursing hospital administrator is also one of the fellow in this leadership program. So assistant consultant is from our Nepal, Professor Chandrakala Sharma ma'am, and then also especially a few of nurses has also been exposed to various specialty areas as national delegates from Nepal also. So these are the international exposure of our nursing leaders. And now talking about the capacity building activities of nurses in leaders, especially I would like to mention the activities of Nursing and Social Security Division of our division, so which was established in 2075, and it is a separate division under Department of Health Services. And talking about the leadership program, we have been working on leadership of nurses and midwives since the establishment of our division, and working with WHO and with collaboration with WHO, we have developed the training manual, and we have already trained master training trainers. Also has been already completed, and 3 batches of TOT has been conducted where around 90 nurses were master trained, and similarly we also have allocated budget for leadership training in province as well. And similarly now we have envisioned the e-based leadership and management training, which is in the blended modality, including the public private partnership. We also have included the private nursing leaders in this program. So talking about the total nurses, so around 75 nurses have been trained in e-based also, and we have more 2 batches yet to be conducted. And similarly, with the coordination with the Nepal Staff College, we also have conducted leadership management training for 11th, 9th, and 7th level of nursing officer. And especially this is important for the promotion for nurses in their career also. So now in NAN, we also have NAN, as you all have been, known with the National Association of Nepal also, and they also have been, working for the nursing and midwife leadership as well. So they have done various activities. So I've just listed a few of more important activities, like they have been involved in the appreciative inquiry training and also EP nurse. So Nepal has been, honored from this prize of EP nurse also. So EP nurse for disaster management, and they also have been running communication coordination training as well. So NAN also has been, working in the growth and development and capacity building of nursing leaders in our country. So now future plans is like talking about our division is, continuing the blended modality training for especially in the leadership area. We have been trying to do that. And also we have an induction training for newly recruited first class and second class officers. Now, moving to the status of midwives. So, as we have started midwifery education from bachelor level in Nepal, and to promote the midwifery education, to promote midwives along with the Nepal government, and also with the MidSun, we have started the advocacy of midwifery education in Nepal. So there is establishment of MidSun, and there are total number of midwives till now is 26. So now activities of MidSun is like they also have been, developing midwifery educators in Nepal, as still we are, we are lacking the midwifery educators. So for the capacity building of the midwifery educators, trainings have been organized, and also similarly MidSun and along with the other midwives also, they have been advocating regarding the policy implementation, as it has been clearly stated that now we need midwives for the decreasing the maternal mortality in Nepal. So in the policy it has been reflected. So the implementation of policy has been a challenge due to different, the stakeholders are involved. So due to that, still the policy has not been implemented. So MidSun along with our division also has been working to implement the policy and to start the midwifery education smoothly in Nepal, so that we can decrease the maternal mortality in Nepal. And now this is I'm coming to the end. Now there are issues and challenges in nursing and midwifery leadership. So I think yes, it's kind of reflection for all of our developing countries. And yes, as I mentioned earlier, also the deployment of midwives. So now we have produced bachelor level midwives in Nepal, and as we don't have the vacancy post in government level. So I think yes, the deployment of midwives has been always a challenge, and we are looking forward to create posts for the midwifery officers to midwives, so that the midwives who have been produced can be deployed in the Nepal health system. So yes, this has been issues and also challenges, and also the policy hurdles has always there. So because as national policy has defined the need of midwifery education, but still the implementation has been always a challenge. So we are working on that. And similarly, midwifery model of care of practice has not been initiated, as still obstetric care of model has been in practice, and we have been struggling to create the enabling environment for midwives who have been posted in the hospitals, or especially in the women's and children hospitals. And another, I think, issue is interpersonal and intrapersonal collaboration. So the collaboration, the communication between the profession and outside the profession has been always a challenge and issues for us. And the human resource scarcity is also one of the challenges which we are facing. And I think in coming days we will work on that. And then there is a disparities in pay skills. So talking about the private sector and the government sector, there is a huge gap between the nurses working in the government sector and in the private sector. So the private sector nurses who are working there are being paid in a very small scale, or the low pay scale. So there is a disparity in the pay scale as well. So that is also one of the major issues that we nurses are facing in Nepal. And another is ICT, especially the technology, the communication issues, knowledge and skills also has been a kind of challenging for us. But yet this COVID has been given an opportunity to strengthen our ICT knowledge. But still we have been struggling to come forward and adopt this kind of ICT knowledge and skills. So at the end, I just want to share my slide with leaders don't create followers, they create more leaders. And thank you for listening me. If you have any queries, please put your queries so that I can clarify it. Thank you from Nepal.
Thank you very much, Bala, for presenting on behalf of Nepal. That was really fascinating presentation in terms of achievement, challenges, and opportunities for nurses and midwives from Nepal. Thank you very much. Can I now hand over to Fekadu from Ethiopia Nursing Ethiopian Midwifery Association.
Thank you very much, Nora, for giving me this opportunity, and thank you very much, the team. Shall I share from my side or you share? Yeah, thank you very much. So I'm Fukadu, the Director of Ethiopian Midwife Association. I will be presenting the leadership challenges in Ethiopia and in Ethiopian Midwife Association. The next slide. So as you can see, in Ethiopia, actually in the globe elsewhere, 90% of the need for sexual, reproductive, and maternal, newborn, and adolescent health care can be covered by midwives. So midwives are very important health workforce in areas of maternal, newborn, and child and adolescent health care. In Ethiopia, it covers about 90% of the care, and they can reduce 87% of maternal mortality with midwifery intervention alone. So strengthening midwife means like reducing maternal, newborn, and child health care. And next. Just to give you some information about Ethiopian Midwives, the Ethiopian Midwifery Association was established by 1992, and we became a member of the International Confederation of Midwives in 1993, a year later. We have a central office and 12 regional office, based on, we have the state system in Ethiopia. So we have 10 states and 2 city administrations. So we have branches on all areas. In Ethiopia, we have around 20,335 midwives. This is according to government figure, and 50% of these are our members, active members, but all midwives are involved in our care. We have 47 health science training institute, colleges and university training midwives. Unlike many countries in Ethiopia, more than 1/3 of our task force, midwifery task force is male. In most, you will find only female midwives, and sometimes up to 5%. So we have a good representation of male-female midwifery workforce. Next. This is not like a good figure. Actually, it's only 57% of our majority of our midwives are trained at low level, diploma level. We have some few MSc higher level training, and we have started one PhD program actually. Most of our midwives are working in public facilities. Next. So this is like the mission and vision of the Ethiopian Midwife Association. Our goal is to reduce maternal mortality, infant mortality, and to reduce, to have access to quality women through midwifery-led care. So we have 6 strategic directions. 1, enhance membership management system as a professional association. 1, to be our members, to be knowledgeable, skillful, and highly skillful and informed and legally protected. We want to serve the community through improved midwifery care, and also want to enhance the capacity of midwifery teaching institute. We also want to amplify policy and practice change for women health, for reproductive health, and for also midwifery. We want to work on partnership and networking and volunteerism, and we want to enhance regulation and governance through strengthening our continuous professional development system, regulation of midwifery, and we want also to be self-reliance through generating our funds. These are the strategic direction of the Ethiopian Midwife Association. Next. So, as you can see, leadership is critical for effective running of any healthcare system. Ethiopia Ministry of Health system identifies four pillar areas. And one of them is leadership and governance, quality improvement, service delivery, health system capacity. Actually, for the other three pillars, leadership and governance is a key. So it is on the health sector transformation plan of the Ministry of Health, as well as it is on the human resource direction. These are the four pillars, and leadership and governance have been one of the pillar of the Ministry of Health of the Ethiopia. And this is important because it has a significant role in improving the management system, enhancing the working climate, creating a responsive system that is more accessible, better quality, and expand service availability at affordable cost to the community. So leadership is very important. However, next slide. However, despite in Ethiopia, like nurses and midwives are the critical, not only the critical part of the healthcare system, but also they make up the largest section of the healthcare force in Ethiopia. By 2020, Ethiopia healthcare force system is almost 250,000. For actually, Ethiopia has more than 110 million population. We are the second populous country in Africa. So for this, we have nearly 248,000 healthcare forces. Actually, it is below the standard of 2.3 by WHO. Our standard is like almost 1.5, which is our health work, where we still lack the health workforce, which is required by the WHO to achieve sustainable development goal. Of this significant 2004, the significant number are nurses and midwives. As you can see, the nurses are almost 85,580 by 2020, and we have 100. It will be growing up to 127,399 by 2025. Midwives are almost 20,000 by 2020, and we will grow by almost 30,000 by 2025. So this makes the nursing and midwifery workforce more than 50% of the total health workforce in Ethiopia. Next. The Ethiopia, the healthcare system is challenged, the management system. One, these are the challenges of the management system from different sources, and which is identified by the strategy of the Ministry of Health also. One is the existence of weak leadership and governance for human resource at various levels. We have level at ministry level, at state level, at zonal level, and at district level. There is weak leadership and governance for HRH. It is just as a result of poor quality of health workforce, education and training. And there is underdeveloped human resource management system and practice, especially like if you go now and ask the Minister of Health how many nurses are, how many midwives are practicing at this time, they will have to look around and ask for information. So it is not just pop up as they mean. So our management system, our appraisal system, our motivation system, our recruitment system is a bit poor. The HR information system is poor, insufficient financial resource, especially because of this. That is why we have many midwives and nurses trained, but they are not recruited in the system because of the weak finance. And weak interagency coordinating system and weak HRH regulatory system. These are the challenges of the human resource leadership and management system in Ethiopia. Next. So when we come in particular to nurses, these are the challenges in terms of midwives and nurses challenges. Actually, it can work for Africa also and for Ethiopia. One is extrinsic, which is outside. One, inadequate leadership support from the leaders. Nurses, midwives, both are not supported by the leaders inadequate mentorship opportunity for upcoming nurses and midwives. For junior nurses, there is no adequate mentorship for them to grow in leadership opportunity. The other is inadequate resource. Scope of practice is a problem, especially nurses and midwives. They just want to limit them to specific areas and not to leadership and other areas. Leadership, most cases, is only geared to specialty areas. That is one of the problem. Most midwives and nurses are not participating in many positions. Like in Ethiopia, there is a professional called health officers. So they are just given, because of that profession, they are just given to be the manager of health centers. And when you are a doctor, you will be manager of the hospital. So nurses and midwives will not have the highest position. Just this, then when you ask, they will say these are trained for management, and you are not trained for management position. So it seems that like the management position is specifically given to specific professionals, and then they will limit the participation of nursing and midwifery by giving the just leadership position to few professionals. From the midwifery and nursing side, individual competence issue in leadership. That is why we need this training. Actually, it's very important. So in nursing, in leadership skill, most of the nurses and midwives, they lack skill. Program planning skill, negotiation skill, to take positions, to take political decision and negotiation skill. Lack of political support from other parties, like the other parties, they support the higher training and some professionals instead of midwives and nurses. Then the other is from research, they say they have little confidence to take risks. The other is leadership dissonance and leading through ambiguities. These are some of the challenges of nurses and midwives in Ethiopia. Next. The other challenges, nurses and midwives are further underrepresented in the organization and in policy making. For example, there was a study done by the Ethiopian Midwife Association, which identifies that only 3% of the midwives were involved in leadership position. And these are actually, these 3% are low-level positions, like just team leader in the maternity unit, and just sometimes like head of the RH unit. It's not like beyond that. And sometimes there are very few in ministry positions. So that is a challenge, because the other is the no mentorship support. These are the challenges. Next. The other is a leadership type is a problem. Holm and Silverson, they recommend transformational leadership for midwifery and nursing, but in Ethiopia is like mostly it is autocratic type of leadership, like a stick and carrot approach. You will do this one, your duty allowance will not be paid, you will not be promoted, something like that. That type of system. So these are the challenges. Next. So we just this is also another study in Ethiopia, which identify like satisfaction in their job and midwifery and leadership. So having adequate supervision, leadership from their supervisors were more than 4 times higher for those who say they have got better supervision, and leadership from their midwifery are better satisfied when compared to those who say they don't get better support. Teamwork and leadership is very important in job satisfaction in nursing and midwifery, but they are not getting those leadership support from their jobs. Next. This is another qualitative study that affects midwifery satisfaction and intention to stay. So leadership engagement and support have been one of the factors that affects the midwives to stay in their job and get satisfied. Organizational structure, for example, enabling environment, good organizational structure, scope of practice when they have their enriched job, and if they have good scope of practice working in different areas, they engage, they want to stay in that profession and they are satisfied. Professional value and work environment challenges are the factors affecting nurses and midwives in Ethiopia to stay in their job and to get satisfied. Next. What has been done, this is like an intervention, a training opportunity for nurses, midwives, despite like their number, if you can see 130,000 midwives and nurses in Ethiopia, only 170 got the leadership training. Only 170 nurses got the leadership training, and only 30 midwives got leadership training in the past years. So just opportunity for leadership training in nursing and midwifery, despite their number, is very few in Ethiopia. Thank you. So this is just our recommendation from different researchers. Leadership very important for midwifery, as the midwives, just not because they are the largest midwives and nurses are largest proportion of the health workforce, but when they got leadership position, they can be involved in planning delivery of health service. The other, just we need the leadership management and governance training for midwives and nurses. It will help them to accelerate and prioritize the health sector to intervene and to achieve sustainable development goals. And then encourage nurses and midwives has to be encouraged to work on environment where midwifery, currently we are just advocating for midwifery-led care, where midwives will be involved both in leadership and care from the beginning of where the mother comes to in the reproductive age up to the endomenopause. It has to be cared first by midwives. So this has to be encouraged, and then they have to be given leadership opportunity as well as leadership training. Next. Engage midwives in policy and planning decision at all levels of the system. The other is institutional capacity in terms of leadership has to be involved. So this will help midwives and nurses to be advocates for high quality and respectful care. And midwives, nurses should have voice in health policy decision making. Mostly it's just decided by other professionals. So the nurses are not involved in health policy and decision making. So we encourage this one to be practiced so that midwives get their training and as well as opportunity to participate in policy decisions. I think this is all. Thank you very much for giving me this opportunity and for the opportunity given to Ethiopia's midwives.
Thank you very much. Very good. That is
Thank
really
you
fascinating.
Thank you.
Opportunity. Thank you very much. I think we are over time for 14 minutes. We can take 3-minute break to stretch ourselves and take a cup of tea, and then we will come back in 3-minute time. Thank you very much. Hello, welcome back all. I think we can restart our event again, and we are now going to hear our bright nursing and midwife followers to say a word from the program. So I'm now handing over to Harriet Peter to say her word, but we are expecting each follower to have a 2 minute to say his word.
Thank you, Nora Ibrahim, for the opportunity given to me. I'm Vera Harriet, a fellow from Kasutu, Uganda.
Hello?
Do
we have Harriet on the call?
Yeah. I'm Harriet Vera from
You can
Kasutu,
also
Uganda.
have, if he or she is not there, Derek or Francis.
Nura, we can hear.
We have Francis.
I think Nura can't hear us.
Can you hear us? I don't know.
Yes, Harriet, can you say your word? Can you start, please?
Thank you, Nora Ibrahim, for the opportunity given to me.
No, we cannot hear you.
Okay. Good morning from my own side. I'm Frances Veronica Tupoa from Sierra Leone, Bo Government Hospital.
Thank you. We can hear you. Go ahead. Go ahead. Thank you.
I'm glad to be with you this morning and to introduce our program here so that you can know what we are really going through and what we want to do. In the first place, of this information is Bo City here is the second largest city in Sierra Leone. The government hospital here is the program based. The stroke acute program is based in the government hospital here in Bo City. We are talking about over 500,000 population.
Hello, can you hear us now?
Yes, we can hear you.
Yes, I'm
Okay,
here.
thank you.
Okay. The nurses, including the doctors and allied care, health care nurse, workers, that give us the amount, the total amount of that 500,000 people, including the physiotherapists and occupational therapists. But we don't have speech and language therapists. That's our problem here. The partnership between us and the CGHP in Cambridge, in UK. So we have the first group of nurses that are taking this course. This course in the country, Sierra Leone. Our team has spent 6 months in this training. And initially, we had a light idea of taking care of stroke patients. But after spending these 6 months of training, we now know the knowledge of taking care of these patients, how to care plan for these patients. And we now know the 2 types of this stroke. Also, we can boast of taking care of these patients now with the knowledge we have. Now, we are proud to say we are well equipped to discuss these issues with confidence. We had a health awareness campaign last March last year, which one of the national TV stations covered and was played all over the country. So now people know that we have some knowledge about the stroke in both government hospitals in Sierra Leone. And we are 6 in number. Today, we are 6 nurses that have joined our colleagues all over the world to highlight the challenges we are facing. The challenges we are facing now is, before this time, we were lack of the knowledge to take care of these patients. And you know there is COVID all over the world. So we have so lot of challenges in this our part. The COVID was concerned, and now we are still battling with it. We are not having enough equipment to deal with these patients, especially the PPEs and the like. The aprons are not enough, face masks, sanitizers, hand sanitizers. We are just managing to have these things. They are there, but it's not enough for all of us. So we are still battling with it. And we have problem with our leaders here. The nurses are many. We are not of the decision making. And the administrators are in charge of the decision making. So we really want to be part of this decision making because we are larger in number and they are few. So we really want to learn about this leadership skills so that we also can be part of this decision making. The next challenge is that colleagues come in sick, so two workforce is on us, the few healthy ones. We really want to have that solved. And there is a problem again with our colleagues. Sometimes they can't come to work because of financial issues and all the rest. Also, and some for our city. The possibilities are to do this training because we know the importance of this training and we really want to be part of it so that our voices will be heard also as nurses. Since we don't have much to say now because we are not in that leadership stage. So that's why we really want to have this training, and our leaders here will know that we are also part of them. And the skills, as I have said, we know it's very important. We are really yearning to have this training. Like we are able to take care of the stroke patients, but we are also asking that we have a speech therapist and occupational therapist. We really need these people so that we can work together to work things with our people here. So, like I said, I'm Frances Veronica Tokowa from Bo Government Hospital, Sierra Leone. I think that's all I have for now. Thank you.
Thank you very much, Francis. And I'm so passionate to hear from you. What is wonderful insight, information you have, and the challenges you face as a young nurses and midwives in Sierra Leone. And I think there are other similar challenges faced by other nurses in LMIC countries. Thank you so much. We were a pleasure to hear your voice today. And we have only 2 minutes left for this session. Can I invite Derek?
Thank you so much. I'm Derek from Kasusu, Uganda. I'm going to talk about mostly what motivates us to become a Nursing Now Challenge Fellows. One, to promote our nursing skills in the health system. Here is we're going to be putting what we learned into practice. 2, increase our leadership capacity. Since we're going to be having a short course about leadership, so it will help us to gain those skills so that we can be leaders tomorrow. 3, improve the quality of global health projects, since they have given us an opportunity to make a quality improvement project. So it will help us improve and add more skills and coordinate with others. It will help us in networking, both locally and international, because we're going to be interacting with different people and gaining knowledge with different people. 4th, it will help us to gain career progression and improve on our quality of life. Thank you so much for the opportunity you have given me.
Thank you, Derek, to hear from you, and I hope you will be able to achieve all those areas you have highlighted during the fellowship program. Can I now hand over to Jama Ali Igal from University of Hargeisa, and on behalf of the perspective from Health Partnerships, she can say her word. Welcome, Jama.
Hi, Jama. Would you like to share your screen or should I share it for you?
You can share it for me.
Okay. It's another file. Let me find it quickly. Can you see my screen?
Yes.
Okay, great.
Great. Thank you so much, everyone, for having me here today. My name is Jama Ali Gao, and I am in charge of the midwifery department at the University of Hargeisa in Somaliland. So I'm really, really happy to be part of the partnership, and we are very, very excited to get this started today. Next slide. Sorry, I thought. So my presentation is very brief, and I think especially since we don't have that much time, it's a good thing for me. We here in Somalia, a little bit of few pictures of Somaliland today, and a map showing you a little bit where Somaliland is in relation to the East Africa, the Horn of Africa. Somaliland has been through a war, and it's been working really hard on rebuilding the country, and we are post-conflict setting. And although we have one of the highest maternal mortality and neonatal mortality rates in the world, nursing and midwifery profession as a profession is very old in Somaliland. Our nurses and midwives as a profession are very established. People really love to be nurses and midwives. It's a respected profession. And so it's not a new profession that needs to be established or anything like that. People also, parents really like and strive for their sons and daughters to become nurses and midwives in Somaliland. So it's a very honorable profession to be part of in Somaliland. Next slide. So going straight into the challenges facing nurses and midwives in Somaliland, I think a lot of the challenges we have heard already today were already discussed. So I'm just going to go over a few of the most important things that are an issue in Somaliland. And the first one is the lack of continuous professional development. We heard this before today, and I think this is a huge problem for nurses and midwives when you just feel stuck on a ward. If you're lucky to get a job and you have acquired a job, then you just stuck with the old, and you never get the opportunity to continue your learning, to continue progression in your profession, and this creates a low morale for following up into leadership and management positions for nurses and midwives in Somaliland. There's a lack of registration with professional body and professional association, and this is not because we don't have the professional body. We have the National Health Professionals Commission, where nurses and midwives should be registered with, but because of the lack of knowledge and the importance and the emphasis, people don't register. Nurses and midwives don't mainly register with them. And so this creates I know we're talking about advancing the view of people into how they view nurses and midwives positions. And I think this would have been one of the things that would make nurses and midwives viewed as more professional if they have a registration and they have accreditation and they focus on these type of things, because it also connects with the CPD, and also the professional association, for example, would also be their voice and give them support, training. We have SLNMA in Somaliland, Somaliland Nursing and Midwifery Association, and it's very active, but unfortunately, nurses and midwives are not registering and paying registration with their association, which also causes a challenge for them to be going into leadership positions. There's lack of research for nurses and midwives, by nurses and midwives. And with this, I mean, there's already a very low number of published articles from our region by anybody. So imagine nurses and midwives. That is just, they participate with research, they are the data collectors, but usually and always it's for somebody else, it's by somebody else, and also with the publications, you won't see anywhere their name mentioned, or their organization or their hospital mentioned. So it's a shame, really. And also then it, on the other hand, when there's no nurses and midwives, or very few nurses and midwives emphasizing research, clinical research, then also their connection to evidence-based practice is minimized because of this. And then also when they read studies and guidelines, they always feel that it's not applicable to their context. Well, we don't have this and we don't have that. We don't have that issue. And the problem is that nobody has looked at the things that are important to them, because it's, their context is not researched or looked into. So there's also low and unreliable pay. And this has been mentioned before for nurses and midwives. And this causes a lot of things. It causes low morale. It causes that people think, okay, my work is not important. But also for managers and leaders, they always seem to have a problem with improving quality of care, because they say one of the biggest arguments is we don't even pay them that much. These people don't earn enough to be motivated to do their job the way they're supposed to do. So here you have a problem with low quality work, and clinical motivation is low, and this causes high maternal mortality, neonatal mortality, suffering, and things that could have been prevented are not being prevented. And it's all linking with pay and the attitude that comes after low pay or unreliable pay. So sometimes nurses and midwives, you find they're not being paid for 4 months, for 5 months, and they're just volunteers and they do whatever they want and they don't do as much. Whereas if they felt that they were compensated, they do more and do their job properly and even excel in it, and aim to achieve higher levels. Whereas now they say, I don't care. People don't know what I'm going through every day. For leaders, we apply for jobs with you could have had a good there's a problem with that as well. And then you see that people who have more skills in these things, they get, and the majority is just not even top or second or third. They do with their skills in interviewing, in writing the initial CV part about themselves, and explaining exactly their experiences and skills that they have. So the selling themselves is also a problem for them because of this lack of support that they receive in that aspect. There's a lack of very few role models in higher positions in Somaliland, and although we do have nurses and midwives are everywhere. They're in the Ministry of Health, they're at universities, they lead nursing and midwifery institutions, teaching institutions, they are in NGOs, INGOs, they lead a lot of places like Noura, for example. But the problem is they don't really, they think in their mind it's just just a few people that are lucky to get there, but they don't think that they could be one day doing those and working in those higher positions. And there's also a problem with a challenge with interprofessional collaboration, whereby those people in higher positions and leadership positions don't connect with the newly graduates. They don't have that opportunity to connect with them. They don't see them anywhere. They don't have networking opportunities to, and even those who are very experienced but work in clinical settings don't have the opportunity to meet with those who are less experienced or in newly qualified positions. And then there's very few opportunities for quality improvement in clinical settings because of a lot of the things that I've mentioned above, but also when you are a nurse and midwife and you work in a clinical setting and you see the same things that are wrong, and you know that they're wrong and you want to do better and you want to change those practices, it's difficult for you to do it by yourself. And so they miss those opportunities, and the challenges are so much higher than the opportunity to make a change. So I'm really, really happy about this type of projects that are doing exactly that, giving people who are in the clinical areas the opportunity to do these quality improvement projects. And I think also they are in the best position to make those changes because they are in the clinical setting. It's not an NGO or an INGO that just comes in, asking them to make those changes. Changes are best when it's from bottom up, from the ground up, from those who are in the clinical area that come up with it and that want to make the difference. Next slide. Okay, so what we want to do and what we can do here is we obviously, you will be providing this amazing training in leadership and quality improvement skills. And I think this will be amazing, but especially since I've seen the time plan, and I think these are very, very amazing, really good thought of and designed for this project. We will deliver those chosen projects successfully. I'm sure all the fellows will do this properly, and we will rise to the challenge, and we will deal with issues that come up, and we will support the fellows to the fullest so that we can ensure that these projects are successful at the end of the time plan. We have to ensure information sharing with health professionals and the community, other nurses, other midwives, also mothers, children, people who are in the community, people who have been served in their hospitals. We have to find a way to, when we're finished with the project, hopefully share the findings. I haven't seen that anywhere, but I think that's very important for motivation and for the follow-up of after this project, this quality improvement project. We have to create trainers program. I think after the fellows have received all this training, there should be a way for them to continue what they learned and share what they learned with their colleagues, and for every region or country to be able to continue what they learned and continue make use of all the knowledge that they've received. And this will also support nurses and midwives in their professional development, for them to continue make use of what they have learned, but then also to continue ensuring that the changes have been established and they have been institutionalized, and leadership and management knows what happened, and they're given the props that they deserve in what they have achieved. I have a small example. We have the SET Nursing Talent Group. Participants have expressed that they are very interested in research, and Noura has contacted me, and we have a few research studies planned for the University of Hargeisa Midwifery Research Center. And these are 4 studies, one focusing on FGM and midwives, traditional birth attendants and their position in sexual reproductive health in Somaliland, post-abortion and post-abortion care study. And we have contacted the fellow, the talent group participants in Somaliland, and we have identified those who were interested in conducting research. And so we traveled, we just came back the day before yesterday. No, I think yesterday. And we have, they have traveled with us. 2 of them have participated in data collection in the remote region. And we have, they have participated in data collection and are now also part of the transcriptions, the transcribing, and they want to also participate in the analysis process. The other 6 will participate with the plan and plan to join in data collection in the rest of the regions within the next 3 weeks. They were very motivated, found the studies very interesting, enjoyed traveling to places they've never seen, and they've created new networks with other nurses and midwives in some of them have decided to join the follow-up studies like masters in nursing and sexual reproductive health next year. And this is all because of funding we already had we used funding we already had from Dalarna University in Sweden, where I am also a PhD candidate. And so this shows you that if you connect the right things at the right time, it's all about the leadership and connecting the right dots together. Since Noura has contacted me and we already had the funding and the opportunity, and these guys were motivated in doing this with us, we have connected the 2. We are so happy and proud of what we have achieved. Thank you so much for listening to me. Next slide.
Thank you so much.
Thank you, everyone.
That is really appreciated. I'm now handing over to Judy and NST to take us through the training program. And then this is followed by 5-minute question and answer session. So can I now hand you over to Judy?
Good afternoon, everybody. It's a pleasure to be here this afternoon, and I hope you can all hear me well in the different parts of the world that I see since we started this launch this morning that we are all from. My name is Judy Hanyola, and I'm the chair for the Center for Nursing and Midwifery at the University of Global Health Equity in Rwanda. And I'm very, very honored, pleased, and proud to really be part of this exciting work that's being led by the Burdett Trust for Nursing, by THET, and all the key important people across the world in Asia and in Africa, particularly for us at this point. That's just culminating in this effort that I myself, being a nurse, I'm so proud and happy to be part of. I know we have somehow really gone over the time, so I won't take up too much time, but just wanted to present an overview of the training program. I've listened keenly to all the presentations from Nepal to Ethiopia, and then to the fellows themselves in Uganda and Sierra Leone. I've chatted a bit with those who are in Zambia, and even listened to Somaliland perspective as well. And just really feeling even the weight of the burden on me to really give a good acquit myself around just skilling the nursing and midwifery leadership. So I'm going to just give a very quick presentation which just gives an overview of the training and the plan that we have. We're actually starting not too far away from here in a few hours on Monday, the 31st of January. So I hope all of you are raring to go. It was really nice to see some of you students who I'll be now going into depth with come Monday. So let me just move quickly to the presentation. The training program will be offered by the University of Global Health Equity, often just the acronym UGHE, which is in Rwanda, and Ubora. Ubora is actually a Kiswahili word, and coming from Kenya, I know, and my Tanzanian colleagues know what Ubora means, which means just good or goodness. And the Ubora Institute is a quality improvement, actually the first of its kind in Africa, Africa-led organization in Ghana. And my colleagues, Ernest and Jonas, are really integral in taking us through a lot of the QI issues. And together we will provide training for you early career nurses and midwives in the 8 countries that have been identified. The 61 of you have actually been very excited to just go through the work that you've been doing, to read a little bit of your CVs and the great work like in Sierra Leone when they talk about managing stroke patients. It's really exciting. This program will take over 12 months, but the actual training in and of itself is really from January, well, I could say February, because we just started the tail end of January through to September, but we'll be having ongoing issues around M&E even after that. And we have 61 early career nurses from Zambia, Uganda, Sierra Leone, Bangladesh, Nepal, Ghana, Tanzania, and Somaliland. And for me, really exciting to see you this morning. I won't take up too much time. This was alluded even by Fekadu in his presentation on Ethiopia. We are the largest health workforce, nurses and midwives. And it's important, even Aled alluded to it from Somaliland, on why midwifery and nursing leadership is important. We direct patient care and therefore we impact lives. So somebody who has that, to me, I see it's such a unique power, really needs to have key leadership qualities. We need to change the status and profile, and this was very, very well said by Lisa when she gave her presentation on the Nursing Now and the challenge that that they've been doing. I've been part of the Nursing Now challenge from 2018 up to 2021. The Nightingale Fellowship, which came first, and now the Nursing Now Fellowship. And Professor Lisa Baylis-Pratt really talked well around the need to change the status and profile of nurses and to ensure that they're included in decision making. And all of you from Ethiopia to Nepal to Somaliland, all of us are really, really keen and are feeling the gap that comes because nurses are not included in many of the decision-making arenas that we should be. We need to understand then why leadership is important, not just at the bedside, but beyond. And it's important, I think, also for us as nurses. And again, my colleague also from Somaliland, Jama, alluded to this when she talked about nurses don't see how their careers will progress, they get frustrated. And so even this program will begin to give us the skills and the importance and the need to know how our careers as nurses and midwives progress. So the training program is going to be made up of 2 key components, leadership and quality improvement. It is going to be in 6 parts. I've called them parts because each one of them has a different angle to it. And so it's made up of what we are calling workshops, which are 5 days, week-long intensive from Monday to Friday. And we are going to have part 1, which is looking at leadership. 2 modules, 8 units will happen there. Then we go to part 2, which is looking at the quality improvement, and that is 10 days, 3 modules with 13 units. We move from foundational issues more to now the proficiency, which is also 14 days, 4 modules and 16 units. And then we have another, what I'm calling part 3, 5-day intensive workshop, where we're now going to look at the application and the proficiency of both leadership and QI. And then at the end of course, part 5 is made up of implementation. You're going to take time to actually, go ahead and work independently with support from the training team and our coaches to implement your QI project, to write it up, to appraise it. And then at the end, which is our 5-day week-long intensive workshop 3, we'll have the presentation of your project and yay, our graduation. So broadly, this is how the program is structured. Sorry about that. That was and looking more at the content, we're going to look at, when we are looking at nursing leadership, module 1 is looking at leading self. And when I listen to the presentations from this morning from Fekadu in Ethiopia, when I listen to Jama from Somaliland, and even from the Nepal, the mid-zone work that is happening in Nepal by the midwives in Nepal, it's important. One of the things that are coming out is, how do we challenge the status quo? We are all clamoring to be on the decision-making table. We are all clamoring to say that nurses and midwives need to be in leadership positions beyond just managing health centers. We want to be at the ministries of health. We want to be at global decision-making tables. We want to be at regional bodies and national bodies. But I always say it starts with myself. Then you have to learn to lead others. How do we do that? We have to understand that now we are living in a fast-paced, almost instantly, all the time changing world. How do we lead the change? And last but not least, even as we are looking at sitting at those decision-making tables, how do we work on leading organizations? And then when we are looking at quality improvement, we are going to see the introduction to quality management and healthcare, the science of improvement, problem identification and analysis. So what really is the problem? And many times I think we fail here because we are not able to identify the problem. So what comes after that doesn't work because at the beginning we did not identify the problem and analyze and understand what the problem is. And then of course, how do we measure? And then how do we test and implement the changes that we are proposing? And of course, last but not least, like we said, you'll analyze and present your QI project, the data that you will have collected. We are going to do all this online, of course, all of us coming. So this is just a quick screenshot of our canvas. Our program is already up and running. I want to pause at this point and ask you to put on the chat if you students have received an email on how to join Canvas. Can I get a sense of that? Because that was to happen. It's the first thing I did this morning. Did we get, you can put on the chat and said, yes, I got the email from UGHE. Yes, I got the email from UGHE. Did you all get the email? And this is just the screenshot of our canvas and where we'll be interacting starting Monday. So I don't know, Audrey can help me if people got it, and if they didn't, then I need to go back after this and make sure that you all have the link. We are also going to share the Zoom link, which will be a recurring Zoom link that will allow you to join. And this morning, my colleague in instructional technology should have shared with you the video of how to use and access and get onto this Canvas platform. We recognize that there are challenges. Time, we are stretching from Bangladesh, Nepal, to Sierra Leone, to Ghana, to Zambia, to Tanzania, to Somaliland, which is at the Horn of Africa, like Jama showed us. So we know that time can be a challenge in terms of all of us being together at the same time, the time difference, but also because I recognize you are so critical as nurses and midwives in the work that you do. So getting time off from the key roles and jobs that you do is not easy. We do understand that. We also understand the challenge of internet connectivity. We have certainly faced it this afternoon, even on this launch. So again, recognizing that the program is flexible, we will be able to have catch-up sessions for those who feel they've missed. There's an email you can write, which will be responded to if you're facing certain challenges. I urge all of you that the only way we can make this happen is if we openly communicate with this with each other when challenges come about, because they do, and help us as teachers to help you. So don't wait for a problem to go so far that then it becomes harder. The moment you see you're facing challenges, I know in Malawi, they had a hurricane, which has really destroyed a bit of their electricity and internet connectivity, and these things happen. So conscious of that, we are really going to be flexible and make sure that we meet everybody's needs. I want to stop there and take any questions if there are. Thank you very much for listening to me.
Thank you, Judy. I just want to mention that a lot of people have said they have not received the email with the details on how to log in on Canvas. So that's something that we will need to do today. And if anyone else has any other question, please, you can unmute yourself or put your question in the chat box.
Thank you very much. I hear you, and I'll follow up with IT to find out why you haven't received your emails. That should be sorted out. Thank you. I see.
Thank you very much. Patrick, is that Patrick?
Yeah.
Could you please ask if you have a question? Please unmute yourself and ask.
I don't know if Patrick can hear us, so perhaps we can go to James.
Thank you very much, and good morning from here. I'm James, I'm Ghana. I am the lead for this program in Ghana. I want to find out, in a previous conversation during the inception training, there was a question I asked about whether there'll be a platform for us as their leads in Ghana and other countries to monitor their progress. I just said about the Canvas email. Most of our people have not received it yet. Is there a plan for us to have another platform where we can monitor their progress, see where they need help and support them throughout, or will be left out of the Canvas platform? Thank you.
I'm not sure, James, what is it the access to Canvas that you would like, or is it the ability to perhaps support students? Because there are various ways we can do that, and I'm very happy to discuss further. So I'm not sure, because you are welcome to join Canvas, and I wasn't able to invite you because I didn't have email addresses for those who would like. I would bow to Audrey on that. But you know, just being on Canvas, I'm not sure if that's really answering your ability to monitor the progress of the students. So you can help me on that, and we can work together on how best you see us doing this from the partnership side. Thank you.
Okay, so not necessarily being on, maybe we'll have to have a platform where we could monitor their progress, but we have that conversation sometime, and then we'll share with you on what I think. But I think it's a good program. Thank you.
James, I'm very glad to hear that. I'm sorry, I could ask Audrey to perhaps send me the emails of all of you who are heading the partnerships, because you bring up a very good and pertinent point for us to see how we can work together to support. Certainly joining the Canvas is straightforward, and that can be done very speedily. Thank you.
Yes, thank you, Judy. We will. I will share the email addresses of everyone, and then we can grant access to the partners as well, because I think everyone is interested to see a bit more on the content, and maybe to assist to a few sessions as well, if that's possible.
It is, Audrey. It is, certainly. I'm very happy to support. Absolutely. Thank you.
Do we have any other question?
Someone asked in the chat, I'm just going to read it. Oops, sorry. I think the question was, if there are going to be an evaluation on the different modules. So I think probably some kind of tests.
We will have exercises and assignments and planned readings. And we are conscious, again, I didn't want to make this extremely academic because you will get a certificate out of it. So we are more or less looking at pass fail and not so much, the focus really will be on the implementation of your QI. And then as we go along to just make sure that you're understanding the material and not getting left behind, we're looking more at the pass fail rather than grading you rigorously like we would if this was an academic program. I hope that answers you. Thank you.
Hello, I have a question. I would like to ask.
Yes, go ahead.
Yes, my name is Hussein Bahanzika from Tanzania. I would like to get a much more explanation about the Converse application or that platform you are going to use. Is just any software we need to install in a computer, or just the application we can install in our phones?
You can do it both, but I would suggest on the phone it's a bit difficult because you have to scroll through and go to different parts of the canvas. So it is better to use a computer, whether desktop or laptop, but you can download Canvas for your Android or iPhone, whatever phone you have. It is certainly there, and if you are far away, you can use Canvas on your phone. So that is available. The email that is coming to you directly is going to show you how to get onto Canvas. There's a whole YouTube video that will help you understand how to get onto Canvas, and I will follow up today and tomorrow to make sure that all of you are situated on Canvas before we commence on Monday. Thank you. Ernest, my colleague from Ubora, I see you there. Please chime in.
Yes. So I just want to encourage the fellows that this is going to be a very fantastic learning opportunity. And the learning would not just be from we, the facilitators, like Jonas and Judy and I, but it's going to be learning even among fellows. So there'll be a lot of cross-learning from fellows to other fellows based on the projects that they are doing. But just to reiterate the point that Judy just made about the assessments, we do intend this to be a rigorous academic assessment. So we'll follow through in terms of the participation on the exercises, the projects that you'll be doing practically, and then we'll have a way of giving feedback and, and all that. But more so, for some of the concepts that will be taught, especially in the QI sections, we intend to send you what we call a self-assessment. So we'll send a self-assessment to fellows. It is designed like a Likert type scale where you can assess yourself and grade yourself from 1 to 5. So depending on the proficiency you think you are in whichever concept, a tool or a strategy or a skill that you have, that we will itemize in all the modules that we are going to teach. Then you can take wherever you are. When we finish this whole exercise, we'll do a post self-evaluation again. And then we will then compare what you assessed yourself to be at the beginning and then how you assess yourself when you finish the program, so that we can see the capacity you have built for each of those concepts, each of those tools, each of those strategies or a skill within the period of the training. And then we'll use this to help in the evaluation. So what am I trying to say? The supplemental evaluation that we'll do will be driven more by yourselves as fellows rather than for we, the facilitators. So it's going to be all teach, all learn, peer learning, and I think this is how it's going to look like. So thank you very much.
Thank you, Ernest. In addition, I know we are slightly over time, but on the Canvas, once you have access, you'll see the rubric that we are using to grade, which, like again, Ernest has said, is more of a, a Likert points where we are giving a few points for participation. Of course, if you don't participate in this program, it will be next to impossible for you to gain much from it. We are giving a few points for participation, but more than that, we are giving points for the project and how there's a rubric that's sort of just giving a scale on how that will happen, and you can look at it and familiarize yourself with it so that you know as a faculty what areas we are really looking at. But like Anessa said, more of the self and the peer learning, and then with support from us as faculty, and of course, majorly really the implementation of your QI project. Thank you.
Thank you, Judy and NST, for presenting the program. And I'm going to thank all of you for joining the launching event today. We are fascinating to see the program starting. And if you have any questions, require any clarification, please don't hesitate to send us an email. I hope Judy and NST will be there to support. Audrey, myself will be also there to support you all. Thank you so much. Some of us may be joining another meeting now. So thank you very much. Bye.
Thank you, everyone.
Thank you so much. Looking forward to seeing you all. Thank you very much. Well done, guys. And congratulations to our fellows. We look forward to Monday.
Thank you, and have a good day.
Thank you, Judy. It was very nice presentation. Very nice explanation and presentation.
Thank you.
Thank you.
Lovely, lovely. Well done, all of us.
Well done. Yeah, thank you.
Yes.
Thank you,
Yeah.
guys.